Hello and welcome to another episode of Coffee Talk with Encore. Today, we're going to be discussing approaches for dementia therapy. Well, with so many therapy patients in senior communities having a diagnosis of dementia, it's important that clinicians know the most effective approaches to engaging with these patients and really help them maintain their dignity along with the highest quality of life possible. And with that said, there are many approaches that therapists can use to help make each and every therapy session an effective one.
So we have to think for those who have a diagnosis with dementia, they lose their ability to understand what's going on around them. Our faces may not be familiar to them. The situation may not be familiar to them, but our residents still need our help and they need our interventions as therapists because we have the ability to help increase their quality of life, to maintain their level of independence. But for us to be able to do that, we really have to learn the best ways to work with them. So in order for us to have successful outcomes with our residents who have dementia, we sometimes have to change and adapt our own approach and the way we see therapy and how we interact with them in order to meet their needs. And I'm going to pass it over to Ashley. She is going to highlight some of the ways that we can do that.
Definitely. So just kind of some, kind of global approaches for patients with dementia when you're working with them is just really coming to them with a warm greeting, just smiling, really simple things like making eye contact and kind of getting down to their level. So if they are in a seated position, like in a wheelchair, or even sitting at a dining room table, just getting down to their level so you can make eye contact and so they don't feel like they're being towered up over. So just even those simple kind of care approaches can really make a huge impact. So how just kind of put yourself in their shoes. If you were kind of confused and really didn't know a whole lot about what's going on in the environment, if somebody's coming in and towering over you, telling you what to do, how would you react? So speak in short, simple sentences. And then really make sure that if you are providing choices, so whether it's, you're helping them with a morning ADL and you're giving them choices between two shirts, making them choose between a couple options to give them that sense of control and allow them to be part of the process. And that kind of goes throughout the entire day. So even if you're a different discipline, maybe you're working with them at a meal, give them choices between the menu options. So yes, they would prefer peaches over yogurt or whatever their preference is, but just allow them to be able to, choose between two items, give them a lot of visual cues if they need that, and just making it, a low stress interaction. So you can really, kind of establish that rapport with them and, gain their trust. And then you can kind of go ahead and proceed with your therapeutic interventions.
So one of the things that we need to remember is our patient's emotional mood when they're in their treatment session. And we want to make that emotional environment the best that we can for our residents and our patients. And the three scariest words for a patient in those early stages of dementia are, do you remember? Because as soon as you say those three words, they start to panic that if they don't remember, is it that normal memory? Is it a sign of dementia? Are you going to think it's a sign of dementia? Are there symptoms getting worse? So we want to really avoid those words when we're interacting with these patients. Instead of asking them if they remember something, just start talking, reiterate what happened in the past, reiterate what you did the day before, and let them know that we're going to build on it today so that we're not instigating that fight or flight response inside that patient. We don't want to trigger that anxiety because as soon as we trigger that, we have lost as humans the ability for natural learning process. Once we go into that flight or fight response, we're no longer capable of learning in the normal pathways. And so for those patients that are still in that early stage, they have the ability for some learning unless we take it away from them by putting them into that emotional response. Additionally, we don't want to trigger that fight response. So if you have a patient that you're working with and they say something that either is not true or it conflicts with your plans, or maybe they're having a delusion at the time, you're going to want to avoid arguing with them because you don't want to trigger that fight response. So if they're telling you that it's Christmas and you're looking outside at that beautiful June weather, don't try to tell them it's June. Just ask them about something that they enjoy doing at Christmas. What's your favorite Christmas cookie? What's your favorite Christmas song? And let's go with that and keep them in that good emotional space where they're happy and we can enjoy our therapy session.
Good points, Becky. One more thing that I kind of want to add on to that is we want to make sure that we're taking our time when we're speaking to the residents and allowing them to really process what we're going on or what's going on around them and what they want their specific response to be. So as we know, with the progression of dementia, the speed that they're able to process that information is going to decrease, but we still need to make sure that we are being patient, that we're allowing them to have the time to process what's going on and really come up with a good answer of what they feel.
Definitely really, really good points. And I did want to add in, one additional item here is that it's really important for clinicians to be aware of how loud those busy environments can be and what kind of adverse effects it can have with those with dementia. It can be really overwhelming with that stimulation. It just gives patients too much coming in sensory. So we want to make sure that we are watching out for, giving patients too many choices when we're communicating. Watch out for those busy environments and those areas where there's too much noise, whether it's indoors or even outside. Because what that can do is it's then going to trigger unintended behaviors. It's going to potentially cause patients to become overwhelmed, frustrated, angry, or even withdrawn. So doing things like moving patients to a quieter location or turning on soft music, it's going to make that huge difference in those with dementia and really reduce the likelihood of those unintended consequences. And I did want to bring up that we haven't found anything to be specifically proven to prevent or delay dementia, but there's a lot that we know that we can do, whether it's ourselves as clinicians or even the patients that we're working with, to really help, include some preventative measures into our daily routines, that being increasing our physical activity, controlling our blood pressure, and really performing cognitive training exercises like brain fitness. Well, I do want to thank everyone for joining us today, for listening in and hearing our discussion on approaches dementia therapy. And we look forward to having you tune again next week for our episode of Coffee Talk with Encore.